related to significant medical conditions that we've already assessed. But I think that's important because what that means actually is the risk per 100,000 so far, into the outbreak, 6 months into it, is in fact that we're looking at about 0.1 per 100,000. So another way to say that, it's 1 in a million. Now, I'm not trying to belittle that. I'm just trying to make sure we look at it proportional, because if you do the same thing for influenza deaths for school-age children over the last 5 years, they're anywhere from 5 to 10 times greater. So I want people to understand the risk properly as they make that decision. I mean, that, I think, as you saw, the American Academy of Pediatrics recommend that distancing may be as limited as 3 feet. Okay, we're going to argue that the key issue is wearing face coverings, as opposed to grounding yourself like locked in stone. That say the terms people have heard a lot about 6 feet. When we talk about 6 feet, what we talk about is, how do I define if you're exposed to somebody with COVID? If I have COVID and we're together, how do I determine who was exposed and who wasn't? And CDC has defined exposure as someone that's within 6 feet of someone that's infected for more than 15 minutes without a face covering. So I do think as we begin, but there has been another cost that we've seen, particularly in high schools. We're seeing, sadly, far greater suicides now than we are deaths from COVID. We're seeing far greater deaths from drug overdose that are above excess, that we had as background, than we are seeing deaths from COVID.